Upon completion of the extraoral exam, then we'll move into the mouth and do the intraoral exam. Begin by inspection with the lips, again to validate lack of lesions, pigmentations, swellings, or areas of concern. Then generally ask the patient to just try and relax their lower lip as you evert it. You inspect and palpate. Again, check for any firmness or lumps. Same on the upper lips. Then at the same time, you want to check the vestibule. Okay, open. And then that will lead us into checking the buccal mucosa, both right and left side. You may need a light. If you don't have a dental light, a pen light would work quite well. And you can check the integrity of the buccal mucosa. Again, looking for the absence of lesions, redness, swelling, or any other concern. This appears pink, smooth, no breaks in the mucosa. Now, while checking the buccal mucosa, you also need to check salivary flow. There are two ways to check salivary flow. We want to validate that the patient's flow is normal because it has a major impact on digestion and caries susceptibility. You want to check the parotid gland, looking at the papilla of Stenson's duct, which is at about the second molar location. You'll want to palpate and milk the gland forward, visually checking that the secretions are clear and watery. Do this on both sides. Another way to also validate that there's adequate salivary flow is when the patient opens, you want to check the floor of the mouth and validate pooling in that area as well. You can also check the flow of the submandibular glands by milking forward, again, and validating that the salivary expression is clear and watery, at least not extremely viscous. From there, we can move on to check the hard and soft palate. Open for me. You'll have to ask the patient to put their head back a little bit, visually inspect the hard palate for the same things: color, consistency, lesions, and integrity of the mucosa. Check the soft palate. We'll use a sterile tongue blade. I want you to just say, ah, ah, perfect. At that point, you'll be able to visualize the tongue will drop down, the soft palate will rise, and you'll visualize the uvula and the oropharynx area. Again, looking for the absence of any purulence, swellings, or areas of concern. If the uvula deviates to right or left, that might indicate a concern that needs to be followed up. At that point in time, we want to do a further inspection of the tongue. Looking at the dorsum, we want to validate the absence of any lesions, nodules, and then we'll move on to inspect the lateral and the ventral aspects of the tongue. To facilitate that, you'll just ask the patient to stick your tongue out at me, and then you want to gently wrap the gauze around the tongue, pull the tongue to one side or the other. You want to check and palpate the lateral border, pull the tongue up, check the ventral, and again take another look at the floor of the mouth. Do that on both sides. You want to check, palpate, lift the tongue up, and at the completion of that, I will ask the patient to lift their tongue and touch the roof of their mouth, and I will check the ventral tongue in this fashion. Occasionally in elderly folks, you may see pronounced veins on the lingual aspect of the tongue, which would be normal varicosities. This concludes a review of the basic procedures involved in a routine head and neck screening exam.